Hello everyone, welcome back to Medinare. In this video, let's discuss about chickenpox in pregnancy. I have already uploaded a video about the pathogenicity, the clinical manifestations of varicella zoster virus infection in detail in part 1 of the videos. I recommend you guys watching that video first, followed by this. So let's begin. So to have a small recap of the previous video, chickenpox, also known as varicella, it is a highly contagious viral infection caused by the virus called varicella zoster virus. This can be dangerous for both the mother and the baby. Chickenpox tends to be more severe in pregnant women than other people, and it is also teratogenic in nature because varicella zoster can pass through the placenta and reach the fetus while the mother is encountering the varicella zoster virus infection. Most of the adults who have already had chickenpox during childhood provides them with lifelong immunity. However, if the pregnant woman has not been previously infected or vaccinated, she can have chickenpox infection during pregnancy. So depending upon the period of gestation, that is when the mom is getting infected, getting exposed to the varicella zoster virus, we can classify the manifestations like fetal varicella syndrome and congenital varicella. So let's talk about each of them in detail. If the maternal varicella occurs during first half of pregnancy, then the fetus is usually asymptomatic. But if the mother gets varicella infection during the second half of pregnancy, then the fetus may develop fetal varicella syndrome, which manifests with cicatrizing skin lesions, limb hypoplasia, which means the limbs will become shorter, chorioretinitis, and some CNS defects such as microcephaly. Some babies may not exhibit any defects but may carry latent varicella zoster virus infection. Now let's see what happens when the mother gets varicella virus infection near delivery. If it occurs like a week or more before delivery, the mother should have developed antibodies against those viruses. And as a result of this, the child would remain asymptomatic. And you guys know why, because the maternal antibodies traverses through the placenta and reaches the fetus. And therefore, the baby doesn't get any infection. If the mother gets infection 5 days before or 2 days after the delivery, maternal antibodies would not have been produced in such a very short time. And that's when the baby develops neonatal varicella, also known as congenital varicella, which is a severe form of chickenpox with mortality rate more than 30%. It may manifest with pneumonia and encephalitis. As a treatment for such conditions, the treatment should be started very early, okay? The babies are given varicella zoster virus antiserum and chemotherapy immediately after birth. So if a pregnant woman develops chickenpox, it is important to seek medical attention promptly. So the healthcare provider will evaluate the severity of the infection and recommend the appropriate treatment options. Chickenpox during pregnancy is prevented through vaccination. However, chickenpox contains a live attenuated virus which is not recommended for pregnant women. Therefore, it is essential for a woman to ensure that she is vaccinated before getting pregnant. To conclude, chickenpox in pregnancy can pose risk to both mother and the baby. So it is crucial for the pregnant women to ensure that they are immune to chickenpox before conceiving. So if the mother is exposed to chickenpox during pregnancy, prompt medical attention is necessary to monitor and manage the situation appropriately. That brings us to the end of the video. I hope you guys found this helpful. The other parts of the varicella zoster virus infection will be uploaded soon. Kindly do watch all those parts as well. Thank you for watching.